Anticholinergic drugs, mechanism of action, adverse effects, and uses. A 72-year-old man is brought to the emergency department with sudden confusion, agitation, and visual hallucinations. His pulse is 126 beats per minute, his pupils are widely dilated, his skin is hot and flushed, his mouth is completely dry, and his lower abdomen is distended because he cannot pass urine. His family reports that he recently started a medicine for overactive bladder. How can a single drug class cause delirium, hyperthermia, tachycardia, and urinary retention, yet also treat COPD, motion sickness, IBS, and organophosphate poisoning? The answer lies in understanding anticholinergic drugs, their mechanism, effects, uses, and dangers. Mechanism of action. Anticholinergic drugs competitively block muscarinic M1 to M5 receptors, inhibiting acetylcholine's effects on the parasympathetic nervous system. Organ-by-organ effects of muscarinic receptor blockade. Now let's see how anticholinergic drugs affect different organs. Since these drugs competitively block muscarinic receptors, they inhibit normal parasympathetic activity throughout the body. In the eye, they cause mydriasis and cycloplegia, producing pupil dilation and loss of accommodation. In the heart, blockade of vagal tone leads to an increased heart rate. In the lungs, they produce bronchodilation and decreased secretions, making them useful in asthma and COPD. In the gastrointestinal tract, they decrease motility and secretions, helping relieve intestinal spasms. In the bladder, reduced detrusor contraction results in urinary retention. Finally, in the glands, they cause decreased salivation and sweating, explaining the characteristic dry mouth and dry skin seen with these drugs. Understanding these organ-by-organ effects makes it much easier to predict both their therapeutic uses and adverse effects. Anticholinergic syndrome. Dry as a bone, red as a beet, hot as a hare, blind as a bat, mad as a hatter, full as a flask. This classic mnemonic captures the full spectrum of anticholinergic toxicity, all arising from suppression of normal parasympathetic function. Decoding the mnemonic anticholinergic syndrome. Dry as a bone refers to dry mouth, dry skin, and reduced sweating due to suppression of exocrine glands. Red as a beet describes flushed skin caused by compensatory vasodilation when sweating is impaired. Hot as a hare represents hyperthermia because the body cannot dissipate heat effectively, especially in children. Blind as a bat refers to mydriasis and cycloplegia, resulting in blurred near vision. Mad as a hatter describes confusion, agitation, delirium, and hallucinations, particularly in elderly patients. Finally, full as a flask represents urinary retention due to decreased detrusor contraction. This single mnemonic summarizes the classic anticholinergic syndrome and is an excellent way to recall its adverse effects. Clinical uses. In COPD and asthma, Ipratropium and tiotropium produce bronchodilation, improving airflow and relieving symptoms. In IBS and abdominal cramps, hyoscine and dicyclomine reduce gastrointestinal motility, providing symptomatic relief. For overactive bladder, drugs such as oxybutynin and tolterodine reduce involuntary detrusor contractions, helping control urinary incontinence. In eye examinations, atropine and tropicamide are used to induce mydriasis, allowing better visualization of the retina. Atropine is also the antidote for organophosphate poisoning, where it reverses life-threatening muscarinic manifestations. Finally, scopolamine is widely used for the prophylaxis and treatment of motion sickness. Contraindications. In narrow-angle glaucoma, they cause mydriasis, which can dangerously increase intraocular pressure and precipitate an acute attack. In benign prostatic hyperplasia or BPH, reduced detrusor contraction may result in complete urinary obstruction. In patients with constipation or bowel obstruction, further reduction in gastrointestinal motility increases the risk of paralytic ileus. They should also be avoided in tachyarrhythmias because they can further increase the heart rate. Finally, anticholinergic drugs can worsen myasthenia gravis by reducing cholinergic transmission at the neuromuscular junction, unless they are being used along with acetylcholinesterase inhibitors for specific indications. Therefore, before prescribing an anticholinergic drug, always ask yourself whether blocking the parasympathetic nervous system could make the patient's underlying condition worse. Benefit versus risk at a glance. The same muscarinic receptor blockade that produces valuable therapeutic benefits can also cause significant toxic risks. Therapeutically, anticholinergic drugs help the lungs by producing bronchodilation in COPD and asthma, reduce intestinal motility in IBS, improve bladder control in overactive bladder, produce mydriasis for eye examinations, act as an antidote in organophosphate poisoning, and prevent motion sickness. However, the very same mechanism can also produce dry mouth, flushing, hyperthermia, blurred vision, delirium, and urinary retention. Therefore, context is everything. The same receptor blockade that opens airways in a COPD patient can cause life-threatening delirium in an elderly patient with BPH. The dose, patient profile, and comorbidities determine whether anticholinergic drugs provide therapeutic benefit or cause toxicity. The right drug in the right patient at the right dose makes all the difference. Key takeaways. Let's conclude with the key takeaways from anticholinergic drugs. First, remember the mechanism. These drugs competitively block muscarinic receptors M1 to M5, thereby inhibiting parasympathetic activity across multiple organ systems. Second, recognize the characteristic toxicity remembered by the classic mnemonic dry as a bone, red as a beet, hot as a hare, blind as a bat, mad as a hatter, full as a flask. Third, appreciate their clinical value. Anticholinergic drugs are widely used in COPD, IBS, overactive bladder, eye examinations, organophosphate poisoning, and motion sickness. Finally, always exercise caution. They are contraindicated or should be used with extreme care in glaucoma, benign prostatic hyperplasia, bowel obstruction, tachyarrhythmias, and myasthenia gravis.